California is now reporting what the CDC describes as very high levels of flu as cases surge nationwide. Visits to doctors' offices and emergency rooms are the highest they've been in the last decade. Today, I spoke in depth about this as well as the rise in RSV cases among children with the medical director of Eisenhower Health's emergency department, Dr. Eutham Contaxis. Dr. Contaxis, I'd like to start by asking you about the flu. What are you seeing here in our valley locally, and why do you think that the CDC is classifying California as very high levels of flu?
Well, because we're seeing very high levels, particularly Influenza A. We've seen a big, sharp increase over the last 2 weeks. And despite vaccination, I think the vaccination rate's a lot lower than it normally has been in the past for influenza for a number of reasons. But I think it's still not too late to get your flu vaccine, and I'd recommend it. But we're seeing a large number of a large volume of patients coming to the emergency department with upper respiratory symptoms. And I also think people that normally might stay home are a little more likely to come to the hospital because of the COVID anxiety and fear that they've had with upper respiratory symptoms. They want to make sure they're okay. And I can reassure you that this is just like any other flu. People that are normally healthy will tolerate it fairly well on their own with fluids and medication for fever and rest. But if you are one of the high risk groups, which are the elderly with comorbidities or the very young, you do need to come in and get evaluated by your physician, either at the urgent care or in the emergency department.
Why do you think that there are such high levels of influenza A, especially among children?
Well, I think it's pretty clear that the last 2 years, children have been isolated significantly from school exposures and group exposures. So you're seeing really 3 years worth of flu exposure in 1 year. So normally this would be spread out over a couple years. And what you're seeing is now everybody that never had been exposed to it before are getting exposed to it. We had very low rates the last 2 years.
What about RSV in children?
Similarly, normally we have a spike in RSV between October and January, even as late as March sometimes. RSV is a common virus. It can occur in adults and kids. We are finding it more and more in adults because we're actually testing for it with their viral panels. But in general, this is a pediatric disease. And in terms of risk, the very young children are at risk for bronchiolitis, which is a spasm of the lung bronchioles and can cause low oxygen and certain types of pneumonia, viral pneumonia, and they need supportive care. There are antibody treatments for it, and people that are high risk can get a vaccine, especially pregnant women who there are some vaccines available. But in general, what we need for RSV is supportive care. And that means that pediatric patients in the hospital go up when we have a large number of cases. And again, just like the flu, we've had 2 years where we saw very low levels of RSV, and now all these kids are getting exposed to it for the first time.
For those pediatric patients, are they being treated at the hospital, or are you having to send them to pediatric specialists outside of the valley?
So it depends. So the milder cases, the ones that can be treated at home, we send home with treatments to help with their lungs and their breathing and give them instructions to return if things get worse. Usually those kids do just fine. Then there's a small group that are very sick that need to go to a pediatric tertiary center, which we will transfer the patient. That's been one of our issues, is that those are pretty full. So we're managing patients in the emergency department, waiting for a bed for extended periods of time. And then there's this moderate group that most of the local hospitals can take care of in their pediatric departments, in their wards.
How concerning is this for you, Dr. Contaxis, that we're seeing not just the flu on the rise, but also RSV? And what do people need to know to protect themselves?
Well, of course, viruses happen every year. This is a natural occurrence among people. We all need to realize that immunity comes from being exposed to viruses. And so as you get older, you're more immune. So when you're young, you get exposed to a lot of colds and upper respiratory infections. And so what I am concerned about is that the volume of cases exceeds our capacity. So that's the big issue is, can the emergency departments, can the hospitals handle this larger volume of patients that we uh, probably should have anticipated and tried to anticipate, but again, there are shortages in terms of nursing and capacity that make it a little bit difficult. So my only concern is for these patients that are very sick. They need to be seen in the emergency department. They need to be seen at tertiary centers. And those are the ones that we need to focus on. And then the milder cases, if your child has an upper respiratory infection and is not having trouble breathing and their oxygenation's good, they can stay home and ride it out. They should do just fine. But I think there's a fear component. So a lot of people come to the hospital to get evaluated, which we understand and want to help them. But at the same time, it leads to large volumes of patients that may be able to go home or may be able to be managed at home.
Is the hospital overwhelmed?
No, we're not overwhelmed. We're whelmed. We have a lot of patients. People have to be patient in the community to realize that we are a community service. All the hospitals are. We take all people at any time, day or night. And so when we have large volumes, we have to triage and take the sickest first. And that can be very frustrating for patients. And we just ask that people realize that when it's like this, we are a community and we have to support each other and be patient. And we'll do the best we can to make sure we see every single patient in a timely fashion and make decisions based on their acuity, who goes first and who doesn't. So those are the big issues. I think we're going to get through this just fine. I think it's going to take a lot of work on our part, which is great, and a lot of patience on the community part. And if we work together, we'll be able to overcome this. And then moving forward, as the annual cycle continues, we'll get back to more normal numbers.
All right, Dr. Contaxis, as always, we appreciate your time. Thanks for joining us.
My pleasure. Thank you. Bye-bye.